How was your meeting?
I
Why did she bring me so panicked?
Yeah, just COVID update today's date.
Alright, bye. Cool. What was the pushing? I didn't stop. It's not bad.
Yeah. Making it. Pulling the back out before I go. Yeah, yeah. That's a late night.
The market's moving, are they? Yeah.
Great suit.
It is good.
Yeah.
Dan walks into the room and is like,
you guys like to see a cake as well?
I absolutely do. I think this is not working for you. Okay. Come with me to the security office after this.
Essentially just don't need a code.
He does.
No, you do. Jason needs to escort. Probably today.
Yeah.
We need somebody who can throw a blade around.
Yeah, exactly. Any opportunity to continue looking at the suit, right?
Wow, real flustered now, guys.
When did you get it? That's not bad.
Just leave it locked down. Why? Just like
Yeah.
So I got my wedding suit here. Yeah. So, two jeans and then I just got tailored to the fit.
That's good.
And even from down the jet, it's just probably super cheap because it's all made by that one site. Oh, this is in pounds. I'm not wrong with that. Oh, wait, no, no. The running, the rating, it's got very line, light.
I don't know who is that.
Oh, no. I reckon
Well, when Brown and that head thing down.
Oh, yeah, yeah. The best. As soon as someone stood up, they just walked across the camera.
No, we don't have a story.
With that other crap.
No, we were able to go and record ourselves.
Barely.
Talk me through that.
Drilled into the zero. I'm not sure entry service would be happy about that. I'm not sure it'd be very popular, but I don't believe you. Or maybe I'll do it my last week.
Yep.
What's that?
Well, I should choose my plan.
It's next few weeks. You'd have to give 4 weeks notice, eh? Yes. No, that's the thing. I'm just waiting.
No big crowd. Well, he's great on it.
Probably this one. But we're trying one.
I'm saying,
Oh, actually, no.
maybe the parents.
Yeah. I'm not sure I'd call it next. All right. Kia ora everybody, good afternoon. Today we're going to cover off progress on the rollout, the Group 3 rollout of the vaccine. Saliva testing, we'll talk a little bit about the situation in Melbourne and what we know about that and what we're doing around that. But first I thought I'd run through the vaccination numbers that are being released today. As of midnight last night, we've delivered 562,149 doses of the vaccine across New Zealand. That's an increase of more than 85,000 doses on this time last week. Within that, 191,000 people have now received both doses, meaning that they have full vaccination. Yesterday, we administered more than 16,000 doses nationally, and overall, we continue to track around 8% ahead of the rollout plan. Today, I also want to provide an update on our progress around Group 3. Group 3 includes everybody 65 plus, those with disabilities, and people who have relevant underlying health conditions. It's a big group. There are well over 1 million people within that group, so it is a big group of people to reach, and vaccine supply continues to be a challenge at the moment. There's a lot of interest in Group 3. People who are in it want to know when will they have the opportunity, when will they start. We've said from the beginning that there'll be some overlap between the different groups. So Group 1, then Group 2, then Group 3, but within that there would be some overlap, and there is overlap at the moment. I can confirm that the latest advice that I've had is that all DHBs have started people in Group 3, but their ability to move further into Group 3 will depend on securing additional supplies of the vaccine, and some of that won't be until July, because that is when we're expecting to see some larger deliveries. So DHBs have started in Group 3, all DHBs have started Group 3, but that doesn't mean that everybody that's in Group 3 can be expecting to get a vaccine immediately. So everybody in that group will get more information. They don't need to do anything more until then, until they have that information. So it's a case of don't call us, we'll call you. And we'll be providing regular updates around Group 3, and you'll hear some more about that next week. In other developments around the wider COVID-19 response, today I have announced the expansion of saliva testing in our frontline facilities. As a result, more than 1,400 New Zealand border workers can look forward to less frequent invasive testing for COVID-19, whilst we continue to be very rigorous around our surveillance at the border. Saliva testing is a really important step in our mandatory testing. It complements our nasal testing, which remains the gold standard and has served us incredibly well in New Zealand as we have sought to keep COVID-19 out of our community. As a result of the Ministry's recent request for proposals process, we've today announced that the successful tenderer for the delivery of saliva testing at the border is Asia Pacific Healthcare Group. Extensive due diligence was completed as part of a very competitive tender process, and the advice that I have had is that the Ministry is satisfied that the combination of two tests, so that is the saliva tests and the nasal tests, but less frequently for some workers, along with the frontline managed isolation workers being very close to being fully vaccinated, just chasing up the last of the people for their second dose, that will continue to provide us the assurances that we need at the border around keeping COVID-19 out of the community, whilst also providing an opportunity for some of those frontline staff to reduce the number of nasal swabs that they have to have taken, or the frequency of nasal swabs that they have to have taken. We do know that some staff have been tested with a nasal swab more than 100 times since our COVID-19 response began. That's an enormous personal commitment to our COVID-19 effort, and I want to extend a very sincere thanks to all those who have been in that category. Having had the nasal swabs, I know it's not a hugely pleasant experience. Those who are doing it frequently and regularly, I think we all owe a great thanks to. So today's announcement means that workers who have to be tested once a week for COVID-19, because they are in important roles where the risk is a little higher, they can move to incorporating saliva testing, more frequent saliva testing, into their testing regime in exchange for reducing the frequency of the nasal swabs that they have to have. So that's going to be, there'll be a phased rollout for that. That'll begin next month in June, which is not far away. And these workers can choose to be part of that, or they can choose to stay with their existing testing regime if they want to. We're satisfied that starting the introduction of saliva testing that we are starting the introduction of saliva testing at the right time, but we move with caution to make sure that our testing regime remains very robust, that the compliance with the order, the border worker testing order, can be accurately monitored, and that we can monitor the rollout of the progress of saliva testing as well. As with all COVID-19 testing, the saliva tests will be processed by appropriately accredited New Zealand laboratories. So once again, thank you very much to our frontline health workers, those who are being tested frequently. We acknowledge that it has been a significant burden on you. I hope that saliva testing as an option will help to relieve some of the discomfort that you may have been experiencing. I'll now hand over to the Director General for an update on Melbourne, and amongst other things, and then we'll get into questions.
Thank you, Minister. Kia ora koutou katoa. Pleased to report there are no new cases of COVID-19 in New Zealand today, either in the community or in managed isolation. Our labs processed 4,776 tests yesterday, and the rest of our usual numbers will be on the Ministry's website and in the media release. So a quick word on the situation in Melbourne and wider Victoria. Ministry staff remain in very close contact with our counterparts in Victoria. We're keeping a close eye on the outbreak there, particularly as it relates to quarantine-free travel. As you all know, we provided advice that the Minister accepted and acted on yesterday to pause quarantine-free travel with Victoria, particularly through Melbourne, for 72 hours. That took effect from 7:59 p.m. last evening. It's never easy making these decisions and providing that advice, and we weigh up a range of factors. However, with the situation still evolving yesterday and this, what seems to be still a missing link in the epidemiological chain there, even though the whole genome sequencing has shown the link back to the case identified on the 11th of May, I do feel it was a proportionate and appropriately precautionary response to keep COVID-19 out of New Zealand. It is possible, given the time between that case on the 11th of May in North Melbourne and the subsequent cases, that there is other community transmission as yet undetected in that area north of Melbourne, the so-called Whittlesea area. And so we're asking anyone who has travelled from Melbourne or from Australia who has been in that area since the 11th of May to please be tested at least 5 days since you were in that area. There have been over 10,000 emails sent out to people who have travelled back from Melbourne in the last, or travelled to New Zealand from Melbourne in the last 2 weeks. Those emails went out yesterday with information. We've had 2 people who self-identified that they had been in a location of interest, and they have returned negative results. It is very important that anyone now who has been in Victoria since the 11th of May keeps a close eye on the development of any symptoms of COVID-19, and if in any doubt, ring Healthline and organise to have a test. And remain isolated until you have that test result back. New Zealand has to date done well in its response, and we are focused every day on ensuring it's our number one task, I should say, is keeping the virus out of New Zealand, and every day, mostly invisible, there is an effort going in by thousands of people to keep New Zealand and New Zealanders safe and protected from this virus. We have seen over the recent weeks that even countries and jurisdictions that have previously done well in their responses by taking a similar approach to us have now got community outbreaks. Taiwan has rightly been lauded as having one of the world's leading responses to the COVID-19 pandemic. It's currently experiencing a rapidly growing outbreak, on the 22nd of May reporting 723 cases compared with just 5 cases a fortnight ago. So having achieved an elimination status back in April 2020 without the use of lockdowns, Taiwan has now got an extended, what they are calling level 3 restrictions to the whole country, to the whole jurisdiction. And I dare say it shows that one can never be too vigilant with this virus, and we are remaining on our toes to make sure that we don't end up in the same situation here. As part of that, it's very important that whilst it feels like things are normal here in Aotearoa, everybody needs to keep playing their part. Most importantly, as we go into winter, and people will get symptoms of coughs and colds, the usual winter coughs and colds. If you have symptoms, do not go about your usual daily business, work or school or going out. Isolate, ring Healthline and get advice about getting a test. That is how we will continue to do well. The usual hygiene measures we need to remind ourselves of: coughing or sneezing into our elbows, good hand hygiene, and of course, as is required, using a mask on public transport and when on domestic and international flights. It would be remiss of me not to exhort everyone again to be vigilant in using the COVID Tracer app. As has been shown, when you get a situation like now in Melbourne with a rapidly growing number of places of interest, if people are using the app, it makes the job of contact tracers so much easier, and it also means we can get around these sorts of outbreaks far quicker than if we don't have that information. So please do make it a habit of using the COVID Tracer app whenever and wherever you go. Of course, it will also be important that everyone takes up the offer to be vaccinated when their turn arises over the coming 6 months, as we roll out the vaccine to a further really 3.5 million people, with groups 3 and group 4 coming online. Finally, our team internally, with advice from a technical advisory group, has reviewed the international evidence outlining which health conditions put people at greater risk of getting very sick if they do catch COVID-19, and these are people who will be eligible as part of group 3 if they are age 16 or over. So it already includes people who have any health condition that means they are eligible for a free publicly funded flu vaccination, including pregnant people. We have also added in people with severe mental illness, people who have hypertension that is not well controlled with medication, and those who are severely obese. A lot of work continues to go into plan for and deliver on the vaccination program here in New Zealand. There are some very promising pilot that has happened of our booking system, and we'll have more information about that next week. And I want to thank all those involved in the program to date, and indeed all those who have already come forward to be vaccinated, and encourage everybody to take up the opportunity when they are offered it. Thank you, Minister.
Why has the rollout of the vaccine to the general population been put at the end of July now, possibly pushing it back by weeks? And have you been entirely upfront about that?
I think what I indicated in my speaking notes was we always envisage there would be some overlap between groups. So if you look at group 2, for example, we're well through group 2 now. We're not completely finished, but there's still, but we've made really good progress there. Starting group 3, but we simply won't have enough vaccines by the end of June to do all of Group 3. So that means that when we start Group 4, we'll still be having the bulk of Group 3 to do. So people who are in that fourth group, I think need to bear that in mind, that they're likely to be waiting a little bit longer while we continue to make good progress across Group 3.
It is a delay in the start of that group though, right?
Well, I mean, ultimately, supply has always been a factor that's going to play a big role in determining how fast we can move with any of those groups.
You'd signalled that there might be a 2 or 3 week problem with supply, right? But I mean, initially the starting point was from July, which was broadly understood to be the beginning of July. So it has been, and I'm not attacking you here for it, but it has been pushed back by a few weeks, right?
Well, July is July, so it'll still be from July.
So it's a delay?
No, I wouldn't necessarily say that, but I think just keeping in mind all of the things that we have said about the fact that the middle of the year was going to be the point where we had the most constrained supply of the vaccine.
Why do we have to find that out from a change of wording on the Ministry of Health website? Why not telegraph it to the public more clearly?
Well, I mean, I think our message to the public has always been, when your opportunity arises, we'll get in touch, or the people who are going to be administering the vaccine to you will get in touch.
Do you have numbers on how many people in that Group 3 have actually had a vaccination yet?
No, sorry, I haven't got that, unless the Director General's got.
Not yet, and it varies by District Health Board, and it depends the circumstances under which they were vaccinated. That may be because they are part of a family group that has already had someone in Group 1 or 2.
Is it possible to provide a breakdown of those priority groups? I know there's been demographic breakdowns, but what about by Group 1, Group 2, Group 3?
It's not information. We don't ask people when they come for their vaccination, what group are you in? But we are obviously providing the breakdown by age group and also by District Health Board.
So how concerned are you about the supply of vaccines?
We haven't got a confirmed delivery schedule from Pfizer yet for post 1st of July, so we know what we're getting between now and the end of June, and our delivery plan, our model, very much works to that. We're expecting within early June, so first week of June, to get an understanding from Pfizer of what's happening post-July. Now, obviously, we're in the same position of a lot of other countries, waiting to hear from Pfizer exactly who's getting what and when.
Could it be a case, though, that our whole vaccination rollout grinds to a halt while we wait for another shipment of Pfizer?
No, but it may mean that we have to slow down a little bit at the beginning of July to make sure we don't get into a position where we run out. If we're not getting a reasonably sizable delivery early in July. Now, bearing in mind that our agreement with Pfizer is that they will be delivering us all of the vaccines that we need to finish our vaccination program between July and September, but the delivery schedule hasn't yet been completely confirmed. And every other country that's that's awaiting this information is in the same boat here.
So, to clarify, the delay or the changing of wording sort of from the start to the end of July is because of we're not getting as many vaccines as we thought at the start of July, or
we don't know, but I wouldn't read too much into that wording either. We've always been clear that it will be relatively sequential, but not completely sequential. So there will be some overlap between groups. We will be still endeavouring to start Group 4 in July.
delivery schedule being
Is there
confirmed?
anything you can do to speed up the delivery schedule or to get it further? Can you ask Pfizer nicely? Can you pay more? Is there other stuff?
I can assure you that everyone is leaning on Pfizer, not just New Zealand, every other country that's trying to secure vaccines from Pfizer. I think Pfizer have been pretty straight up in the way they've been handling this process. They are committed to honouring the contractual agreements that they have with New Zealand and with other countries as well. And so I do have trust that they will do that, and they will do that well. When they give us a delivery schedule, they stick to it. And so I think we're probably just a week or so away from finding out what that's going to be.
The Auditor General looked at this program 2 weeks ago. So the Auditor General looked at the vaccine rollout, and two of the recommendations were on communications and transparency. Recommendation 6 was improve communication planning to be clear about key events and associated timings for things like the rollout. A week after the AG put out that report, you guys updated the website on a Friday and didn't tell anyone that you were doing this. Like, are you failing on the AG's recommendations here?
I might ask the Director General to...
I don't think it's failing at all. In fact, and I'm happy to speak to that. And that was trying to give more clarity to people. You've got to remember when we gave these indicative times of when the vaccination program would roll out to different groups, this was back in February and March when there was still a lot less certainty about the program and also the vaccine deliveries. Part of our job is to make sure as things get more certain that we provide that certainty, and that's what the intention was of saying. Yes, it's going to be in July. It looks like it's more likely to be late July, but we would also expect that some people in Group 4 would be vaccinated from July as well, alongside Group 3, because we are still offering a range of ways that people can be vaccinated, including as whole family groups, if that's the best way for that to happen, or out in rural communities. So we've seen that out in some small communities on the West Coast. The other point I would like to make here is, of course, regardless of whether people are in Group 3 or Group 4, not everybody can be vaccinated in June or July. Even as we ramp up from currently around 15,000 vaccination events a day to 40 to 50,000, which is a big step increase. It's a big increase from 80 to 90 locations up to around 800 locations. It will still take months to roll the vaccine program out to all groups, and that's what we're wanting to give people increased certainty about when they can expect to be invited over these coming months.
So I can give you a very approximate breakdown of the different groups based on the first dose administered and the second dose. So around Group 1, around 50,000, just under 51,000 people who are from Group 1, so that's border workers and their household contacts, have had the first dose, and just over 40,000 the second dose. Across Group 2, it's about 271,000, just over, have had their first dose, and about 145,000 their second dose. And across Groups 3 and 4, and I don't have it broken down by groups, it's just under 49,000 first dose and just under 6,000 second dose across those groups.
Bill, if the goal though was to give clarity to people, and I think this does make things clear for some people in Group 4. Who did you tell that you had updated the website and updated the guidance on when it would happen? Who was when was it made clear to people that this clarity was being provided?
I don't actually have that information. I mean, I accept that it may not have been the best way to convey that information, but what I can say is that was not trying to hide or obfuscate anything. And I'm very happy to say here today that actually as we get more information, and just to go back to the OAG report, one of their first recommendations, and the very first one they raised with me a month before the report was published, was the need to let the public know there are uncertainties, particularly in vaccine supply. And so you will have seen us over the last few weeks talk about the uncertainties and be open and honest about that, including today.
So given that people were expecting, in the general population, people in Group 4 were expecting that from the start of July, they could possibly be receiving that vaccine. That's changed based on the website. Are you willing to say that that's now been delayed somewhat by weeks?
Just to reiterate what the Minister said, from July is very clear. That is sometime in July. We have now given more definition about that. You can infer that it meant from the start of July, but it is from July. Yep.
Some weeks?
No, it's not a delay. It's just we've got more certainty about when the program will scale up and also when those groups will come online, proportionate to the vaccine supply.
Can I also note that one of the things we've said right at the beginning too is that there will be some variation within that. So different DHBs have a different population mix across the 4 different groups. So Auckland, they've got a very high concentration of Group 1 around the border. Other DHBs have very few people in that Group 1 category. Others have a high number of aged residential care facilities, whilst others have a smaller group of aged residential care facilities. So there'll be some unders and overs, and it won't be a completely linear process across the country.
But you're confident you're being upfront in any shifts of the plan with the public?
Look, we've always said July is when we're aiming to start Group 4, and that's absolutely continues to be the case.
On spit testing, what makes you comfortable now expanding that when you were previously reticent?
Look, it's been through a very robust process. It's been through a good procurement process to make sure that we're not increasing the risk here. if people opt into this scheme, they will be doing saliva tests every 2 or 3 days, as opposed to every week for the nasal test, and they will still have to do a nasal test at least every 2 weeks. But it will obviously reducing down that frequency from every week to every second week, with more regular saliva testing is potentially more comfortable for those people.
And it's only the highest risk category of workers at the moment.
Well, at the moment, the highest risk category of workers are those who need to be tested weekly. Others are on a fortnightly testing cycle already, and so they'll stay on that for now. But we always keep it under review. But for now, the biggest piece of feedback we've had is for those who are being tested all the time, and bearing in mind that if you're on a weekly testing cycle, sometimes you'll be tested more frequently than that. So if there's an exposure event, for example, that means that you may have been more at risk, you may be tested a couple of times in a week. And so by introducing this, we want to reduce the frequency and therefore the level of discomfort for those people.
If you say from July, any sort of general member of the public will think from the start of July. So is this playing sort of semantic gymnastics?
No.
Question on the saliva testing. When will Asia Pacific be able to begin providing that service to you, and how does that compare to what you requested in the RFP?
So my understanding is in June, but I'll ask the Director General to give more detail.
The plan is that they will have all the processes in place, because what we did ask of all the providers, potential providers, was that they could manage the end-to-end process from collection of the sample through curing them through to the laboratory, processing and reporting of results, and linking those results back to our overall border worker testing register.
If the outbreak in Melbourne worsens, is there any plan for Kiwis who are stranded there?
Look, at this point, we have a pause. If the pause were to continue for a period of time, then we would start to think about contingency planning. But at the moment, it's just a pause. We're acting completely consistently with the framework, which is that we've always said to people, you could be there for a period of time in the event that we needed to pause for a longer period.
If they need to come back, should they maybe look into booking managed isolation or any plans like that?
Look, at this point, it's a pause for 72 hours. If it was to extend beyond 72 hours, then we'd provide more detail and more of an update on guidance.
Have you had any advice that it needs to be extended more than that 72 hours?
Not yet. It's early days yet.
When would you be providing that advice if you had it?
Well, perhaps I'd ask the Director General want to comment on that.
We're reviewing it on a daily basis. We'll formally review it at 48 hours, because that gives us enough time to provide further advice around whether an extension is warranted. I should say also that it's not just the pause on the travel from Melbourne directly to New Zealand, but other Australian states are putting their own requirements in at the border, so that's something we will need to take into account. So it's not simply a matter of a person thinking, I'll book a place in managed isolation and I'll drive to Sydney and come back through that. So there is a lot to be worked through, but at 48 hours, so we'll be reviewing that formally again tomorrow.
Right. The situation with the Waikato DHB, we understand, Dr. Bloomfield, you were warned last year in an IT stock take that the country's health IT systems were vulnerable to significant cyber threats. What was done after that?
Yeah, so one of the bits of work that we've done over the last 2.5 years was a national asset management plan, and as part of that it looked not just at physical infrastructure but IT infrastructure. That plan was made public last year, and it identified a number of areas of vulnerability and underinvestment over many years in IT systems across the wider system. So off the back of that, I wrote to district health boards and asked them particularly to prioritise investment in the areas of cybersecurity and in thinking about their investments, their capital investments, to address that. So I'm satisfied that we highlighted this with district health boards, and subsequently we have continued to work with them, and also we were successful through this budget, through Budget 21, in getting some funding put aside to support upgrading of IT systems, not just in the ministry but out in the wider sector, to address exactly the issues identified in that National Asset Management Plan. Well, our team in the ministry works very closely with them, and in particular our Deputy Director General in this area works closely with the National Chief Information Officer Group, and you can imagine that cybersecurity is one of the main areas that they focus their efforts on.
Yeah.
in the current state of the security systems at DHBs across the country?
I think not just for DHBs, but right across all organisations. The issue of cybersecurity and information security is an ongoing challenge. And it's one we have a particular focus on in the health sector because of the how integral information systems are to our work. What we have done also, of course, off the back of this issue in Waikato, is gone out again to all district health boards, our primary health organisations and other big organisations, and asked them to review their cybersecurity arrangements, and we're getting an update on what actions they've taken in response as well to the Waikato situation.
Are you aware of the situation with the Waikato DHB? Has that had any impact on the vaccine rollout there? Has it been delayed in any way because of what's happening?
The community vaccinators are not affected. They still have access to the COVID immunisation register. Those sites that are run by the District Health Board where they link into the DHB systems haven't been able to link, but they have put in place manual processes, and they are then entering the data off-site at the end of each day to make sure the information is captured. So it hasn't affected the rollout of the program.
Dr. Bloomfield, you've added severe mental health illnesses to the underlying conditions of the Group 3. Can you just clarify sort of what that looks like, what those severe mental health illnesses?
Well, these would be people who are receiving care through formal mental health services, and that may be both inpatient and or outpatient, and they will be under the care of specialist mental health services.
The US is saying to avoid travel to Japan. Are we looking to do the same thing here? Is it safe to travel to Tokyo given the state of emergency?
Look, we haven't made any decisions on that at this point.
Are you likely to? Are you getting advice on it? Or?
I'll ask the Director General to comment on
that. So the team in the Ministry is constantly looking at the situation in countries, particularly those that have got community outbreaks, and we do a weekly update of our risk assessment of countries and where they sit in that, and that goes to the Minister. And if we think there is concern about that, then we will provide advice to the Minister. We haven't provided such advice at the moment, but obviously we will be keeping a close eye on Japan.
Okay, we'll get last couple of questions. Yep.
Do you really believe that when people heard from July, they didn't think start of July? I mean, the Auditor General wrote in his report that the general rollout would begin from the start of July.
Well, like I said, all of the DHBs have started into Group 3. That doesn't mean that they're going to be really ramping up into Group 3 immediately. Really, it's going to depend on how far they are through Groups 1 and 2 and how much supply there is, and some of that population unevenness that I mentioned just before.
Dr. Bloomfield, overseas there's been more discussion around the possible origins of the coronavirus with new research pointing to a potential for a lab leak theory, not that it's confirmed by any means. What do you make of that, and how do you sort of view the evidence out there?
Well, I haven't seen the latest speculation on this. What I would say, though, is that's most pertinent to our collective global efforts, and the World Health Assembly is discussing these at the moment about how we prevent future pandemics. It doesn't, of course, impact directly on our current response.
I'll stay on the side of the ring. Oh, you're done? One more for you. Yep.
Can you clarify which areas, which DHBs will have to wait for the Group 3 vaccination rollout?
Like I said, they've all made a start, so it's not a question of having to wait. But ultimately, how far and how fast they get through Group 3 is ultimately determined by supply. There's over 1 million people in Group 3, and as I've indicated before, we're expecting to be able to do about 1.2 million people by the end, 1.2 million doses, so about 600,000 people by the end of June, and that includes all of our Group 1 and Group 2. So getting into July, we're going to be well into July before people start to get clarity around when they may be able to get one. And I'm hoping within the next week or so, we'll know a bit more about what the supply for July looks like.
What's our stock take on doses at the moment?
So we've got about 300, just over 300,000, but there's actually, in the information that was released today, what you'll see, the regular update, is there is a graph in there, which shows the scale-up model, and it shows you the supply that we have, and what you'll see is that the gap between the supply and what we're delivering is starting to narrow. So we're fully expecting that by early July, we'll be starting to get to that point of potentially running out if we don't start to get bigger deliveries in.
The Melbourne rebels are the Melbourne Rebels appear to be travelling to Sydney from Melbourne before travelling to Queenstown at the weekend. Does that fit within the spirit of, or the intention of the pause?
No, it doesn't, and I've made it clear that they should not be travelling to New Zealand until further decisions have been taken, and that's at least 72 hours is when we've indicated that the current pause applies for.
So currently, as it stands, the game going ahead this weekend is up in the air?
Well, that will very much depend on whether the pause continues beyond 72 hours.
Were they travelling to Sydney to sort of get around that, do you know?
Look, I don't know what they're doing, but ultimately they are covered by the pause if they were in Melbourne at the time the pause came into effect.
If it doesn't go ahead, what will Scott Morrison and Jacinda Ardern do on Sunday?
I think I have plenty to talk about. All right, last few questions, yeah.
There's been a number of job postings in recent days and recent weeks for people working in COVID-19 call centres to book vaccine appointments over the next 2 or 3 months. Is that a sign, like a plan B, for whether or not there's issues with the ongoing issues with the scheduling software, or do you just need people to work in call centres?
Can I respond to that, Minister? So the booking system that is being stood up at the moment and has been piloted in Auckland and Canterbury has 2 ways really of getting into it. We're expecting most people will book themselves online, but it also has the opportunity for people to ring the what is now Whakarangarau, which is the National Telehealth Centre. So they are increasing their number of people, and then they can book an appointment, have the appointment booked for them by someone who's going straight into that booking system. So it's just the option that people will have, and also if they run into problems while booking online, they can ring up the health line and get support to complete their booking.
Just last few questions over here, and then if we have time, we'll come back. Yeah.
Can I just clarify? So, the middle of July.
I was pointing down the front there.
On the Saliva contract, are you aware of any alternatives that could be deployed immediately, much sooner, such as Rako Science, and why were they not chosen?
Well, just to reiterate what the Minister said, there was a very robust procurement process. I personally have seen a summary of both the process and the outcomes of that. I think the decision was an appropriate one, and just to also emphasise that the requirement on the providers was that they were able to do the end-to-end process. So that's one thing. And secondly, it's not a matter of implementing it immediately, because there are quite a few process issues that need to be put in place even within the managed isolation or quarantine facilities or other places where the saliva sampling is going to be done. No, it does take time to stand up what is a whole new process on top of the existing testing.
Okay, up the back.
Thank you, sorry Dan. Just want to clarify, so the middle of July, when you find out when you're going to get the next shipment of Pfizer vaccines, and then end of July, you know, group 4 will start, but is it possible that you could, you know, the vaccination of group 4 could be delayed until August, September, just based on how different DHBs are tracking?
Look, like I said, we're still aiming to start Group 4 in July, but the speed with which we get through Group 4 will depend on the quantities of vaccine arriving in the country.
And how each DHB,
once we get to the point where we have enough vaccines to really be ramping up, the distinctions between different groups will become less important. Still important, because we're still going to need to have a way of managing demand, recognising that demand's likely to be high through July, August, September, but actually there'll be some blurring of the boundaries between groups 3 and 4, given that they're likely to be done simultaneously.
Epidemiologists have asked for the split testing to be daily. Why have you gone for every 2 or 3 days?
Because that's what the advice was from our technical advisory group, and our view is that every 2 or 3 days is sufficient. The sensitivity of the testing is good, except possibly in early infection, so hence more frequent than the nasopharyngeal swabs, and again complementary to those. People will still need to have fortnightly nasopharyngeal swabs.
Amelia, you can have the last question then.
When will you review the advice on permanent residents returning from India?
We keep that under constant review. One of the things that I've been working with Health on the criteria around moving a country from very high risk back down to high risk, because of course some of the thresholds that we have in place to determine when a country becomes high risk become more difficult to monitor beyond that, because one of the measures that we've got in place is the number of people arriving at the border from those countries. As soon as you move a country into a very high risk category, the number of people arriving at the border is going to decrease significantly. So we've got further work ongoing about that, but it'd be fair to say around India at the moment it remains very high risk, and it could be some time before that changes. All right, thanks everybody.